Good evening, everyone. My name is Priyanka, and I'm the Allied Health Integration Program Officer here at CESPAN. And I'd like to welcome you to our webinar on the digital health update for allied health. I'm joined by Grace, who is our Digital Health and Quality Improvement Project Officer, and also Lauren from the CPD team. So I would like to start by acknowledging the traditional custodians and the sovereign people of the land across which we work. I recognize their continuing connection with land, water, and community, and pay my respects to elders past, present, and emerging. I would also like to extend that respect to any Aboriginal colleagues joining us today. So just a bit of housekeeping before we get started. So today we are going to use the chat function to ask any questions. And also an evaluation survey will be sent to you via email after the end of the presentation. So if you could just take some time to fill that out, that would be great. And also we have some upcoming events. If you'd like to register for any of these, you can find these on the CESPAN website. There is also the cultural awareness training. So we have 2 training sessions. So one is on the 18th of June and another one is on the 19th of November. You can just scan that QR code in and register for that. You can also find the details on the CESPAN website. So this acronym, so we have the digital health team has a telehealth upskilling program coming up. So if you're a healthcare provider or you know any GPs who work within the aged care sector and would like to upskill on their telehealth, you can just give us a call or you can just send us an email on the digital health email address that's on the screen. So just remember, this is also eligible for 6 CPD points. So yeah, just shoot us an email and we'll get back to you with the details. We also have our digital health and practice support teams who are here to assist you, your practices across a wide range of platforms. So this could include telehealth, quality improvement, infection control, My Health Record, or Provider Connect Australia. So if you require support, just feel free to reach out to us. Just another update on the urgent care clinics within our region. So we currently have 5 urgent care clinics within the CESPAN area, and the urgent care clinics offer free one-off treatment for non-life-threatening issues. And so these are available free for the Medicare card holders and the community-based asylum seekers. There are also a few Medicare mental health centers within our catchment. You can just find the details here. You don't need a GP referral to attend these clinics. So if you require any more information, just send us an email. Okay, so now we'll get started with the learning outcomes for today. So we have an exciting agenda lined up. So we'll start by an overview of PRODA and how it serves as a gateway to key digital health initiatives such as My Health Record. And then we'll explore what My Health Record is, its benefits, and how you can access it via the National Provider Portal. Following, we will take a look at Provider Connect Australia, its purpose, and how it helps to streamline the provider information. And finally, we'll wrap up with a quick overview of electronic prescribing and the My Health app. So let's get started, and I'll hand it over to Grace, who will go over the introduction to PRODA and how it helps us to connect to My Health Record.
Awesome. Thank you, Priya. Hi, everyone. So PRODA stands for Provided Digital Access. It's a digital verification system which allows users to engage with digital support resources like HPOS, My Health Record, NDIS, National Cancer Screening Register, things like that. PRODA is an online identity verification system and authentication system which allows you to securely access these services. Having a PRODA allows you to get access to HPOS, which stands for Health Professional Online Services, and the My Health Record through the National Provider Portal. So it is a pretty important number to have. If you don't, oh, sorry, next slide. Thank you, Priya. So if you don't already have a PRODA, we've just included the steps here that you need to take to get one. Because it's an identification verification system, you do need to make sure that your personal details are standardized throughout the forms of identity that you're going to use. Any changes of name or address, anything like that could cause some issues. So just try and make sure you have your documents all standardized before you start. And next slide, thanks. So that brings us to HPOS, which is the platform that you can access once you have a PRODA. HPOS stands for Health Professional Online Services, and it's the platform that allows someone with a PRODA to engage with the health services and resources available. So this is what the landing page of HPOS looks like, and from here you can access various services. On the next slide, we'll go through some of those. So some of those services include online claiming, so you can lodge, manage, and reconcile Medicare claims on HPOS. You can apply for provider numbers, initial and subsequent provider and prescriber numbers, and they're also issued immediately when you do it on PRODA, so you don't have to wait for a letter in the mail. You can manage your delegation, so the people within your organization that you allow to act on your behalf when it comes to PRODA, you can manage that in HPOS. You can change your personal details, like update your address, phone number, things like that. Correspondence, you can view and manage your healthcare correspondence, and you can use the MBS eligibility lookup feature to confirm a patient's eligibility for an item number before it is billed. So, next slide. So just to give you an idea of one of the benefits of having a PRODA and using HPOS, I'm just going to very quickly walk through the steps involved in applying for a new provider number once you actually have the PRODA. So you'll log into your PRODA. Log in with your PRODA. Once you're logged in, you'll navigate to HPOS, and then you'll go to My Details, the little tablet there. Sorry, tablet there. So if we go onto that tile, and then you will go to My Provider Numbers. Any provider numbers that you already have will be stacked up there. You can go to Create a New Provider Location, and then you should see a message saying you're eligible to add a new location. You complete all the details. Do make sure that you're very careful with the address in this particular section. Sometimes if your shop is located in a shopping center or somewhere where they have like weird or, lots of different shops in one area, the address might be different from what the government has to what you might use for, say, your postal address. So if it doesn't work, try some variations. So you fill all those details in, and then we go to the next step. Oh, sorry.
Yeah, I
Yeah,
think,
then you're issued with the provider
okay.
number. So it's issued automatically, comes up very, very quickly, and you can start billing from that day.
Yeah.
Yeah.
Thank you, Grace. Like as Grace mentioned, like on HPOS, you can use a lot of features. And in addition to getting new provider numbers, we also have the MBS online checker. So what this does is you can check your patient's eligibility on your own eligibility for claiming a specific MBS item number. So what I've done on the right-hand side of the slide, I've listed all the steps, but in the coming slides, we'll just go through the screenshots on how to actually do it. So I'll just go to the next slide. So first, what you're going to do is you log into your PRODA account. So once you log in into your PRODA account, that's what the landing page is going to look like. And under My Linked Services, you'll see the HPOS tab. And under that, you can see the Go to Services, and you can just click on that. So once you click on that, this is the landing page, and then you'll click on the Items tab on the right-hand side of the screen. Once you're in there, you can see there is a tile which says MBS item online checker. You will click on that. And then it's going to show you this form where it's going to ask you for your patient's Medicare details. So it's going to be their Medicare card number, their individual reference number, and their first name. So you'll enter all those details and their date of birth, and then you will click on the declaration, which you can see on the screen. So once you do that, you can just scroll down a bit, and then it's going to ask you to enter your provider number. So you will enter your provider number, and then you can just scroll down, and then you can just search the MBS item number. So you can either search the MBS item number using the actual number, or you can also filter it based on the care plans. So once you select that, you can just click on the check items on the left-hand side, like bottom left of the screen. So you'll click on that. And it's going to give you your eligibility and your patient's eligibility. So it's going to come up as like if the item is claimable or if it's not. And then you can see on the bottom of the screen, there's a new check. So if you want to initiate another check, you can just click on that and follow the similar steps. So this was the introduction to PRODA and what HFOS can do and all the features. So now we'll go through what My Health Record is. So what is My Health Record? So My Health Record is a secure online summary of an individual's key health information. It's an important element of the system is that it's personally controlled. So it means that whatever is on the My Health Record of the patients, like they get to choose if it can be on their record or if they want it to be removed. So it depends totally on the patients what they want on their record. And most importantly, it forms a part of the national system, which means that the My Health Record of the patient travels with them wherever they go, no matter what healthcare provider they are seeing. So last time we did a similar webinar, we did have a question regarding what healthcare providers use My Health Record. So I've just got all the stats on the slide. So currently in Australia, we have around 99% of the GPs who are currently registered and are actively using My Health Record. So the general practitioners usually upload something that's called as a shared health summary. We'll just go into the details in coming slides. Then we have pharmacies. 99% of the pharmacies are registered and actively using it. And then we have 97% of the public hospitals, 62% of specialists, and 43% of the aged care facilities. We don't currently have a number on allied health because they are still new to the system and without a conformance software. So in coming days, we'll have like better stats on where the allied health providers stand. Okay, so before we go into how to access My Health Record, I'll just briefly go over the healthcare identifiers. So to access someone's My Health Record, the practice and the provider actually needs to have three numbers. So these are the IHI, the HPII, and the HPIO. So the IHI is a 16-digit identifier that is given to every patient who has a Medicare card. So this determines who the care was provided to. And then we have the HPII, that's the individual healthcare provider identifier for the healthcare provider. So this number denotes like who actually provided the care to the patients. So it could be an allied health provider, a general practitioner, a registered nurse, whoever provides the care. And the last one is the HPIO. So it is the health identifier for the organization. So it denotes where the care was provided. So when we have all these three numbers, we can actually say what happened and like have exact details of the healthcare event. So you will need to have all these three numbers in order to access someone's My Health Record. Okay. So now go through the documents you can find on My Health Record. So there are a lot of documents that could be relevant to your practice. So currently on My Health Record, we have three different types of documents. So these include consumer documents, we have the Medicare documents, and the provider documents. So the consumer documents are the documents that a patient can upload to their My Health Record. This would include like documents like their personal health summary, their health notes, their emergency contacts, or their advanced care planning documents. And then we have the Medicare documents. So these includes documents such as like records from the Australian Immunization Register. And then the provider documents are the documents that a healthcare provider uploads to someone's My Health Record. So these will include shared health summaries that are usually uploaded by the GPs. We have the discharge summaries that are usually uploaded by the hospitals. Then we have the pathology and diagnostic imaging reports. We have the prescription records and the dispense records that are usually uploaded by the pharmacies. Okay, so now the question is, how do we access someone's My Health record? So someone's My Health record can be accessed in three ways. So the first one is using a conformance software. That means a software that is able to connect to My Health record and lets you upload or view someone's My Health record. But the only reason, like we won't go in detail about this, is because currently none of the allied health softwares are My Health record conformant, but we do have an industry offer by the Australian Digital Health Agency, and we do expect a few of the allied health software becoming conformant in next few years. And the second one is by using the National Provider Portal, which is a web-based portal. We'll go into the details on how we can use that, and we'll go through a demo video of what's on someone's National Provider Portal. And the last option that is available to the consumers is the My Health app. So the My Health app is a consumer-facing app. So if you don't have access to a conformance software, don't have National Provider Portal, you can always ask your patients to download the My Health app. And just in case, for example, they don't know the dosage of any medication, they should be able to find it on the My Health app. So now just bear with me for like a few seconds. I'm just going to play a video on how to access My Health record through the National Provider Portal and what all documents are on there. Just give me 1 second.
As a healthcare provider, one way you can access and use My Health record is through the National Provider Portal. It is free and allows you to see any of the key health information held in a person's My Health record. The National Provider Portal is a web-based, read-only site for healthcare providers who do not have conformant clinical software that is integrated with My Health record. To access the National Provider Portal, you will need to have a PRODA account. And your healthcare organization will need to be registered to use My Health record. Please refer to the agency's website for information about how to register. Once registered, log into your PRODA account, then select My Health record, which is located under My Linked Services. Select your organization and then enter patient's surname, date of birth, gender, and identifier. Then click Search. The first screen you will see is the Health Record Overview, where you can see any documents uploaded since the last shared health summary. When you scroll down, you will see information from the latest shared health summary, including current and past medical history, medicines and allergies, and adverse reactions. Use the tabs along the top to find other key health information. There are a wide range of documents at your fingertips. Popular tabs are Clinical Documents, Medicines and Conditions, and Medicare Records. Under Clinical Documents, you can find diagnostic imaging reports, pathology reports, and specialist letters, just to name a few. Now let's have a look at how simple it is to access some key health information that may inform your clinical practice. In this example, we will look at a patient's medicines information. To find the medicines information, you can click on the Medicines and Conditions tab or use the shortcut link here. The Medicines Information view will display the Allergies and Adverse Reactions tab by default. Click on the Medicines Preview tab to display the medication summary. Here you can see the patient's medicines and their directions for use. Looking at the Medicines Preview helps you to understand the patient's medication history. Now let's take a look at how to access and view diagnostic imaging reports. If you wanted to see a patient's diagnostic imaging report, it can be found under the Clinical Documents tab. Click on Diagnostic Imaging Report, then you can either search for the event date or find the relevant report in this area. Double-click to open the report. From here you can see the diagnostic imaging report. You can also save a copy of the report if needed. Have a look at my health record today, your health in your hands.
Okay, so that was how you can access My Health Record through the National Provider Portal, and it has a lot of relevant documents on there, like for allied health providers, like physios, like you can see the diagnostic imaging reports, and then like you can even have like quick access to the discharge summaries, just in case one of your patient has been discharged from the hospital. So now we'll go through the privacy and access control settings that are on My Health Record. So as this is a patient control record, so anything on the My Health Record is actually determined by the patient. So they can choose to limit access to their records. So they can either choose to limit the access to a specific document on the record by using something that's called as a limited document access code, or they can choose to even restrict the entire record using a record access code. And the patient can choose to be notified when someone accesses their My Health record. So as a healthcare provider, we just need to remember that there is a function that's called as the glass break function. So it's an emergency access provision that you can use that can override the functions of the record access code. So you can still see a patient's record, but we believe like it's only you should only use it if you reasonably believe there is a threat to the patient safety or the public health safety. Otherwise, there are a lot of paper trails and audits that go on through it. So we recommend don't use the glass break function just because a patient just forgot their record access code. So now we'll go to the next slide. That's about the My Health app. And I'll just hand it over to Grace, who'll just briefly go over the My Health app.
Thanks, Priya. So yeah, as Priya mentioned, we have the glass break function. Obviously, this is not an ideal way to access a patient record just because they weren't able to find something, but the My Health app is a very good way of patients kind of taking control of their health data and kind of being the ones to show you and include different healthcare providers. So the My Health app is a patient-facing app that allows patients and users of the app to manage their health data directly. It's available for free in the Google Play Store and in the App Store. Next slide. Thank you. So as you can see, this is the landing page when you go into the app once you've set everything up. It's very cleanly laid out. It's very clear, very easy to understand. There's a lot of different things that a patient can access here. They can manage their allergies and reactions, which when they do update it through this app, it is automatically updated on the My Health record as well. So if something changes, they update it on the app. They know that they've everyone's going to have that information if there's an emergency. They can review their prescribed medications. They can register for the active script list while in a pharmacy with the assistance of a pharmacist, and they can securely store and share script tokens with pharmacies, like e-prescribing tokens. So they could also, patients can also view and download and share their immunization history, which is very helpful, especially if they're moving across different health districts. They can, or overseas, they can view and download diagnostic imaging or reports, which have been uploaded by various healthcare partners. They can view, download, and share pathology results. So if you're unable to find any results for a patient, whether it's imaging reports or pathology, they should have a copy if they have registered for the My Health app. And they can also download any letters and referrals. So they can send that to you themselves if they're the clinic hasn't sent it to you previously, and they can also register their advanced care directives and manage their organ donation status on the app. So it's a pretty comprehensive app to have. So we do have some frequently asked questions that kind of come up when we talk about the My Health record. Here are a couple of common ones. So what happens if a patient withdraws their consent to upload a document to the My Health record? If the patient withdraws consent, then obviously you wouldn't upload it. If you have conformance software, you wouldn't upload it. If the patient withdraws consent after the upload has been made, they will need to contact the My Health Record hotline on the number there, and they'll be able to organise that removal of that record. And another question for healthcare providers is when to access My Health Record. You can access it only when needed to support patient care. There's no legal requirement for you to access it every single time you see a patient or for every patient. It's only whatever you think in your organization. You'll have your own policies and your own standards of, like, when it's appropriate to access and what you need and what kind of documents you're looking for in the patient's treatment journey.
So we do get healthcare providers asking us the question if they actually need a patient's consent to access the My Health Record. So you don't need to ask the patient that you're accessing their, like, if you should access their My Health Record, because My Health Record, it was a standing consent. So if someone has a Medicare card as an IHI, they already do have a My Health Record. There was a opt-out. Like, people had to opt out if they didn't want a My Health Record, so it wasn't an opt-in service. So everyone with a Medicare card and IHI number by default have a My Health Record, so you don't need to ask a patient's consent. However, I know, like, this information is probably not relevant to allied health, but still, as like a general information, there are some diagnostic reports, some pathology reports where you can't upload it straight away to a patient's My Health Record. So this includes like someone's HIV status, so that can't be uploaded straight away to a patient's My Health Record. We just need to remember that. Whereas if you want to just view a patient's My Health Record, you can just view it without asking for their consent. Okay, so that was My Health Record, and also adding to the National Provider Portal. So the National Provider Portal is a view-only platform. So if you want to upload an information, you won't be able to do that. However, you'll be able to view whatever is on someone's My Health Record. So we just need to keep that in mind. And once the Allied Health have a conformance software, they should be able to upload information onto someone's record. Okay, so now we'll move on to Provider Connect Australia. So we know, like, most of the healthcare provider within the CESPIN catchment, they're usually working as sole traders, and then like they juggle the responsibilities of being like a business owner and a clinician, and a lot of them are time poor and like struggle with like updating their business information with like all the different partners they have. So to make this process more streamlined, the Australian Digital Health Agency developed a tool that's called as Provider Connect Australia, or PCA. So it's a no-cost service that's operated by the Australian Digital Health Agency, and it focuses on like streamlining the provider information. And now I'll just hand it over to Grace, who'll just go through like the purpose and the benefits of PCA.
Thanks, Priya. So Provider Connect Australia gives healthcare providers a means of keeping provider and clinic information up to date with multiple digital health directories and business partners from one source, so in one go. These business partners include hospitals, pathology and radiology services, public service directories, so it could be business to business, or public facing, or both. So you can choose how your information is displayed or who it's displayed to, as well as secure messaging directories. So you can update all of those in one central location. Next slide, please. So when is this useful? So new practitioners joining or leaving an organization, it allows you to add details about a practitioner or services that they bring to the table. So say you're a physiotherapist and you get another physiotherapist in who speaks Vietnamese. That might be really useful to know and really useful to advertise. So you could update your PCA to reflect that in the patient-facing directories, so that patients who are looking for a Vietnamese, physio can find you. Another situation, your organization's contact details change, your location, the address, the operating hours, all of that can be updated in one go. New services or languages are offered, so already touched on that. And you can choose to publish this information, like I said, to other businesses only, or to other businesses and patients, like consumers. So next slide. Yes, so the benefit of PCA, it's more streamlined. It's a more streamlined approach to communication. It won't only improve accuracy in the GP referrals because they're looking at one source of truth information. It'll also increase patient autonomy in choosing their healthcare team. So like I said, patients are going to be able to find out more about the services that you offer, and you find those unique niches that, you know, make them want to go and see you. It will reduce transcription errors by reducing the number of times information is entered into various directories, and it provides a single avenue for updating information, removing the need to fill out multiple forms for multiple directories. So it's a pretty useful tool for a small business or sole practitioner who's, you know, updating or working between multiple clinics, managing a lot of admin. It kind of takes a bit off the table.
Okay, so that was PCA, and now we'll just briefly go over like electronic prescribing. I know like not a lot of allied health practitioners actually have prescribing rights, but just in case we have some optometrists in the crowd today, I just want to briefly go over that, because with the Australian Digital Health Agency offer, like the Allied Health Clinical Information System may become conformant with electronic prescribing as well. So what is an electronic prescription? So it is a digital version of the paper-based prescription, and you can choose to send it to a patient as a token via SMS or email. And then we have another thing that we call as the active script list. So if you have a patient who has a chronic condition and is on multiple medications, so we can just consolidate all the medications on the active script list. So it's a list of all their active prescriptions. So that's what the ASL is. So that was the e-prescribing. So this brings us to the end of the session. So we do have some resources that we want to share. So the video that we just saw on National Provider Portal, so it's actually from a course by the Australian Digital Health Agency. So I've just linked that on this slide. And also, if you want to connect to Provider Connect Australia, I have attached the pre-registration checklist on there. And also we have some My Health Record policies and procedures, and there's a link for that as well. Okay, questions. So if you guys have any questions, just please feel free to put them in the chat box, and we'll just go through them. Any questions?
None yet.
None yet. No, that's all good. So what Grace and we might just go through some frequently asked questions. So one of those questions is like how does a health practitioner get a HPII number? So for all the allied health providers that are actually registered through APRA, so you already have a HPII number. So if you go into your APRA ID, you can see that number there. And for the allied health practitioners that are registered under a different peak bodies, such as like dietitians, you'll need to fill in a form and attach your qualifications and send it via PRODA, and you will receive an HPII number. And for the HPIO number, a business needs to register their organization on PRODA. So if you have any questions regarding how to register that, just send us an email. We'll have our details on the slides. So just send us an email and we can just go through the registration steps with you. Grace, do you have any other questions in mind?
I was more interested in what kinds of documents you envisioned accessing on the My Health record, depending
Yeah,
on.
so we can have documents such as we have a shared health summary. So it's kind of the key health information for a patient. So it includes their allergies, if they have a recent diagnosis, their updated medication list. So it's just all on one page. And that's usually uploaded by the patient's primary healthcare provider, which generally is a general practitioner. So that it can be quite useful for allied health. And then we have diagnostic imaging reports that can be useful for allied health as well. And then we can have like discharge summaries. So discharge summaries are usually uploaded by the hospitals. So for example, a patient has been discharged from the hospital and has like a wound care instruction. And you haven't received a discharge summary, so you can just go into the My Health record and check it. And then we have other documents that are usually uploaded, like consumer documents. Even though it's not relevant to allied health, but it can still have like advanced care planning documents. It can have someone's personal health notes, their childhood history, which could be like useful for psychologists. Yeah, so a lot of relevant documentations for allied health.
Hmm.
Yeah.
Thanks.
Any other questions?
No.
No? Okay. So these are our contact details. Just in case you have any other questions after the presentation, just feel free to reach out to us, and we'll get back to you. Oh, good. Okay. Oh, good. Thank you, Grace, and
Thank
thank you, Lauren, and thanks everyone for joining us today.
Yes, thank
And
you.
I hope you guys have a good night.
Yeah, you
Good.
too. Thank
See
you.
ya.
Bye,
Thank
everyone.
you. Bye.